be simulating that this is a hospital and that this bed has side rails. Hi, my name is Molly. I'm a nurse here at the hospital. I'm washing my hands here for your safety, and I'm also pulling the drape for your privacy. How are you today?
Fine.
Good. Go ahead and let me know your first and last name.
Richard Gonzalez?
Okay, thank you, Mr. Gonzalez. Would you like me to address you as Mr. Gonzalez or Richard?
Richard, please.
Okay, what is your date of birth?
February 25th, 1988.
And your MRN number?
1234.
Great, thank you so much. I'm also checking this against our computer system to make sure that you are the correct patient, and I can see that you are. Do you have any allergies to medication, food, latex, tape, or anything in the environment?
No.
No, not at all? Okay, if you did, I would have an allergy ban here for you, and seeing as you don't have any, we don't have one on your wrist. Okay, and I am looking at you to see if you are in any signs of distress and that you are in a good position, and I can see that you are. Tell me, do you know where you are?
Yes, the hospital.
And do you know who the President of the United States is?
Yes, Donald Trump.
Okay, and about what time it is?
Nighttime, about dinner time.
Okay, good job. I'm going to be looking at your IV site, if you don't mind letting me have a look. I do see that it is dry, clean, and intact. I don't see any signs of phlebitis or any infiltration, warmness. I feel that your wrist is warm, but it's not overly heated, and that there's no signs of infection or infiltration. I'm also, or any signs of edema or erythema. I'm also checking your IV site to make sure that there are no kinks and that the correct fluids are running appropriately, and I'm checking that with our computer system to make sure that the right fluids are running, so thank you so much. I'm going to be checking your hair, skin, nails, and your scalp. I'm just going to be looking to see for any dryness or that there's any hair missing or any cracking. Do you have anything you want to let me know about?
No.
Okay. And I'm also looking at your skin, on your face, on your arms. You see. And I'm also looking for any edema or anything that we would want to notate. Also the temperature to see if there's any issues. And I do see that it is warm. I'm going to be checking your capillary refill in both of your feet. And I'm going to be comparing them. And what we're looking for is a less than 3-second capillary refill. And I do see that. I'm also going to be checking your hands. And while I'm doing that, I am also looking at the patient, Richard, I'm also looking at your nails to see if you have any missing nails or cracking or dryness in your nails, and then for capillary refill, comparing them, and I do see that everything is good. I'm also checking for tinting on your skin to see if there's any signs of dehydration, and looking at your skin turgor, and I see that everything looks good and that you are properly hydrated based off of that assessment. Next, I'm going to be looking at your ears with my light. I'm going to be looking in your ears for any drainage, feeling behind for any dryness, any obstructions or anything like that. I don't see any drainage and that the behind your ears is dry. Go ahead and look up at me, look at the ceiling. I'm going to look in your nose for any drainage or any lesions, something wrong. Go ahead and open your mouth. Thank you. I'm looking for any missing teeth, dryness, to see if there's anything abnormal that could indicate that you're dehydrated. I don't see anything like that. I also did look up your nose. Go ahead and smile for me. Good, thank you. I was looking for facial symmetry, and I just see that your face is symmetric. I'm going to be looking at your eyes now. If you could just look at me really quickly, I'm going to be shining some light in your eye. And what I'm doing is looking for accommodation to see that your pupils do dilate and accommodate to light. Go ahead and follow my pen for me, please. Good. What I was doing was checking for your intraocular eye muscles to see that they are intact, and you were able to follow my pen, so I do know that they are intact. I'm also looking at the color of your sclera, and I do see that it is white. I don't see anything abnormal. I'm also looking at your eyes to see any signs of conjunctivitis, such as drainage, or swelling, or any redness, or anything like that, and I don't see any issues with your conjunctiva. Are you having any trouble breathing or any chest pain?
No.
No, not at all? Okay. Go ahead and just take a breath for me. Good, thank you. I was looking to see if you're using your accessory muscles or if you were taking a breath in the wrong way. But I see that you are using your diaphragm and you're taking a breath appropriately, so thank you so much for that. And that taking a breath is not hard for you. Go ahead and sit up for me. I'm going to be listening to your breath sounds. And when I say so, just take a deep breath and then let it out. Oopsies. Sorry about that. Take a breath and let it out. One more. Good. Another one. Good. Good, thank you. I was looking to see that your lungs were clear, and they are. Go ahead and lay down, please. We have a tool in the hospital that we use called an incentive spirometer. Sometimes patients use it if they're having surgery or other different types of reasons. If I did have one, I would teach you how to use it, and I would ask you to demonstrate it back to me. I'm going to be palpating your carotid arteries one at a time so that I don't occlude them. I do feel that they are present. I'm also going to be listening with the bell of my stethoscope to assess for any brew rates. Thank you. I don't hear any brew rates at this time. I'm going to be palpating your pulses, your radial pulses, to see that they are strong and equal. And I don't feel that they are thready at all. I'm going to be checking your dorsalis pedis pulses to see that they are equal and that they are not thready and they are strong and normal. And I felt them and they are there. I'm going to be palpating next on your PMI, which is located in the fifth intercostal space, mid-clavicular line. And I'm just going to be palpating for any lifts or heaves, and at this time I don't feel any. Next I'm going to be listening to your heart sounds with my diaphragm and then my bell. First I'm going to be listening to, I'm just going to pull this up for your privacy. First I'm going to be listening to your aortic valve, which is in the second intercostal space, right sternal border. Then the pulmonic valve, which is in the second intercostal space, left sternal border. Erb's point, which is in the third intercostal space, left sternal border. The tricuspid valve, which is in the fourth intercostal space, left sternal border. And then I would listen to the mitral valve, which is in the fifth intercostal space, mid-clavicular line. Have you had any nausea, vomiting, or diarrhea?
No.
And when was your last bowel movement?
About an hour ago.
And was that normal for you?
Yes.
It was? Okay, good. I'm going to be listening to your bowel sounds now and just inspecting your abdomen. I'm just going to pull this down a little bit. I am inspecting your abdomen for any abnormalities. I do see your abdomen is symmetric. It's not distended. It is soft and non-tender. And I don't see any signs of masses. I'm going to listen to your bowel sounds now. I'm also going to be listening to your aorta with my bell of my stethoscope. I'm going to be listening for any brew rates. Now, if you didn't have any bowel sounds, I would be listening to each quadrant individually for 5 minutes. Next, I'm going to palpate your abdomen. And first, I'm going to do with one hand and then two. First, lightly. And you let me know if you have any pain. And then with two hands, just a little bit more deep. And I want you to let me know if you have any pain. Did you feel any pain when I did that?
No.
No, none at all. Okay, thank you so much for letting me do that. Have you been urinating more frequently than usual?
No.
No? Okay. When was the last time you urinated?
About an hour ago.
Okay, did you have any burning, any urgency, any blood in the urine, or anything abnormal that you'd like to let me know about?
No.
Okay, and throughout the day, how many times a day do you urinate?
About 7.
Okay. I just want to let you know that throughout your time here as a patient, we'll be calculating your intake and output to keep track of your hydration status through drinking and also through urinating and other sources as well. I just want you to know that we will be monitoring your intake and output. Are you having or experiencing any swelling, numbness, or tingling of any of your extremities or any pain or anything like that? No, not at all? Okay, good. Next I'm going to assess your strength. If you could squeeze my fingers. Good. And push against me. And then pull me. Good. You're strong. What I'm doing is looking for that both of your extremities of your hands and your feet are equal. If you could push against me. Good. And pull up. Good job. I was looking to see that your extremities were equal in strength. All right, that goes ahead and concludes my assessment with you. This is a call-out that we have in the hospital that patients can use to contact their nurse. This circular button you can press to contact me. Could you go ahead and demonstrate that for me? Good job. Thank you so much. This is yours to hold. I'm going to make sure that your bed is in the lowest position and that both of your side rails are up, and that is for your safety. I'm going to be washing my hands for the safety of your, for you, and also the safety of any patients at the hospital. Is there anything else that I can do for you today?
No.
Okay, good. I hope you have a great day, Richard.